Dr. Ali Raja joins us now. He's a professor of emergency medicine at Harvard Medical School. Doctor, always good to have you with us. Well, let's start with that announcement from J&J this morning about the benefits of a booster shot. For their shot comes after the CDC officially recommended boosters for the two-shot vaccines. What more should we know about this J&J information that came out this morning?
Joe, it's coming out right now. I've looked at some of the data. These are data coming out of about 2,000 patients in trials in the U.S. and Europe, and they really do show that about 6 to 8 months after the first Johnson & Johnson, the only Johnson & Johnson shot that's needed for vaccines to be successful, to be good, the booster numbers actually show that there's a really robust vaccine response. So we've all been wondering when and if we'll need J&J boosters for our patients who got that shot, and this is really reassuring that we'll get a good antibody response with that booster shot.
And doctor, there was concern, of course, as you remember, around Johnson & Johnson vaccine the first time, women in a certain age group who had that particular reaction. Would that be a concern again with a booster? Or if you got it the first time and you were okay, does that kind of tell you you're probably safe to get another one? Or would you kind of be in that limbo zone for those 3 weeks after the shot like the first time?
Savannah, it's a great question, and we talked about that a few months ago as well. The fact is that these data have just come out. We don't yet have the data about the side effects and specifically the blood clots. So I'm sure that those data will be released over the next few days as well.
And doctor, as we heard in Gabe's report, there, healthcare workers around the country are really being pushed to the brink right now. Do you think that we're going to get to a point where hospitals would consider denying any sort of medical care to people who are unvaccinated, maybe especially if they're having issues, maybe treating vaccinated people who have other problems?
Joe, it's so exceptionally frustrating. And I've been answering that exact same question with my colleagues that I work with. It's really hard. You know, there are a lot of things that people do that are not good for their health, whether it's driving too fast on a highway on a motorcycle without a helmet or continuing to smoke despite the fact that they know the consequences. I think that we as healthcare workers, we took oaths and we need to take care of everybody. It's exceptionally frustrating when this happens. And I hate the fact that patients aren't getting COVID vaccines when they can get them. But I still think we're going to need to take care of everybody who walks in the door.
Doctor. Oh, go ahead. I think we might have a similar follow-up question there because we actually have some encouraging numbers in terms of new people getting vaccines. The White House task force said yesterday that 6 million people were vaccinated in the previous 7 days, which actually is the biggest 7-day total in more than a month and a half. Do you think that has anything to do with what we're seeing with full FDA approval? Does that help with vaccine hesitancy?
I do, Savannah. I think it's sad that it's taken a surge to convince people to get COVID vaccines. But remember, the vaccine becomes effective about 2 weeks after the second dose. So if patients are getting it right now, they will be protected from getting hospitalized, from getting ICU admissions to dying if they get the shot right now. So I'm encouraged that they're getting it, but it's kind of tragic that it took this surge to do it.
All right, Dr. Raja, as always, thanks so much for your expertise. Appreciate it.
Thanks, Joe and Savannah.